Every welcome trust research program as part of my postgraduate scholarship. So the project is funded by the European Union as well as the African Foundation. It's a project that, so the principal investigator is Professor Amina Abubakar. So some of you might know her. She's the director of the institute. She's also a scientist at Cambridge Wellcome Trust and also a fellow a visiting fellow at the University of Oxford. So this is the team. We have Margaret Kaboy, who is our manager, and I am the partner in ensuring that everything goes well. All activities within the project are achieved. So the project aims to assess and support mental health outcomes among adolescents. We are implementing the project here in Kenya as well as in Uganda. So in Uganda, we are working hands in hands with the School of Nursing and Midwifery at the Aga Khan University as well. So I think I can just go straight to, I won't spend much on the background, but I'm happy that the president of KPA talked about why the youth, particularly the adolescents, are at high risk of poor mental health. Everybody is at risk, as we all know, of having poor mental health, but in particular, the youth, particularly the adolescents, are at high risk. It's a period of identity development. There's so much development that is occurring within that particular period, and in one way or another, it puts them at a high risk of poor mental health. So we all know that. I won't spend much on the statistics as well. I'll go straight to our objectives. So what we aim to achieve in the project is to understand what is the burden of mental health among adolescents in Kenya and Uganda. I'm sure there are quite some of you who are particularly doing that, so it will be interesting to share results and see what you've done and compare with what you've done. So we have a formative study that aims to not only quantify the burden of mental health among adolescents, but as well explore the factors. What is the predictors of poor mental health? We are also interested not only to generate the evidence in terms of the burden, but the drivers, but as well as implement interventions that are geared toward promoting mental health. We are also keen to work with civil society organizations across Kenya and Uganda that we can capacity build so that they can provide mental health services to adolescents. So that's basically the main objectives of what we are doing. For the target population, I'm glad that Dr. Frank Zega talked about the youth with disability, not leaving them behind. So we are happy that we are also targeting adolescents with disability in our work. We have also adolescents who are going to school. We have adolescents who are out of school. We also have adolescents who are living with HIV. But for today, the result that I'm going to share with you is what we have done in the school going and for the out of school adolescents, as we have not completed the other groups. So these are the study sites of the project. We are working in Mombasa, in Kilifi, in Nairobi, that is in Kenya, that's the study site in Kenya. In Uganda, we are in Kampala metropolitan area. So these are the phases of the project. There are 3 main phases, but each phase has some studies and activities underneath each. We have the formative study that I said aims to generate the evidence in terms of understanding what is the burden of different mental health problems. We're not only interested on the common mental disorders such as depressive and anxiety. So we also have the implementation phase where we aim to do an implementation of the interventions. We'll carry a baseline assessment and then a end-line assessments to compare their status before and after the interventions. So this is the overview of the whole project. We have the quantitative study, the qualitative studies, the mapping exercise, the scoping review. All of them are geared towards the interventions. They provide the formative work for the interventions implementation. So what we have achieved so far, we've completed the formative study. So for the quantitative study, our aim was to assess around 1,500 adolescents, 1,000 in Kenya and 500 in Uganda. We also aim to reach around 100 adolescents through the quantitative study. And for the mapping exercise, we identified quite a number of organizations in the country that are actually implementing mental health interventions. So we also conducted a scoping review that we've been able to publish at the Frontiers of Psychiatry journal. Gives an idea of interventions that are implemented in sub-Saharan Africa. So the reason why we did the review was, as I said, to at least we can brainstorm of what others have done across sub-Saharan Africa and what we can incorporate in our setting. And we also identified some interventions that we are now actually looking forward to implement. So I'll share with you some results and findings from our formative work, that is from the in terms of the prevalences of common mental disorders. So we use the PHQ-9 tool to assess their depression levels. And as you can see, the prevalence is quite high, 26%. That's what we found. It was relatively higher among the out of school as compared to the school going adolescents. I think that's expected for the out of school adolescents. I suppose there's quite a lot that they are facing. You know, at least for the school going adolescents, they have the school curriculum, they have their friends around them, they have at least there's food in school, there are teachers in school. But for the out of school, most of them are on their own. They are not out of school by wish. Probably there is a reason why they are out of school, and I suppose there are effort already, at least to ensure that all adolescents are in school. And I think that effort should continue, at least because the levels of depression are quite high as compared to the school-going adolescents. But generally, we got quite high prevalences of depression and anxiety. But it would be interesting to share our work with others that have done the same. I'm sure amongst us we have a team that have done the same. So this is just a box plot to visualize the results for the quality of life, emotional distress, and COVID-19 pandemic anxiety. So the red asterisk is the mean, and the line in between the boxes is the median. And when you compare, I think this is brown, and let's say dark brown. So for the school-going adolescents, let's say like the quality of life, as you can see, it's relatively higher among the school-going adolescents. So it means they have better quality of life. So we use the WHO 5 tool, the tool that have been used to assess quality of life. So for the emotional and behavioral outcomes, we use SDQ, that is the Strength and Difficulty Questionnaire. And for COVID-19 pandemic anxiety, we use the pandemic anxiety scale to assess their pandemic worries due to COVID-19. People, they are worrying about getting COVID-19, worrying about their family not being safe because of COVID-19. So when you look at the emotional distress levels, they are relatively higher in out of school still as compared to the school-going adolescents. For the pandemic anxiety, we didn't see any difference. All of them had the same levels of worry about COVID-19. We did also some regression analysis to identify predictors or correlates associated with poor mental health outcomes. So this is a forest plot, and so we have the correlates here. These are the significant factors that were significant. At least their P levels were less than 0.05, and being out of school, adolescents who are being out of school had those scores as compared to those who are school-going adolescents of having poor mental health, Also, being female was a significant predictor of anxiety, and also adolescents who said that they interacted less with their friends, and I think that shows the importance of peer interaction and peer connection. And adolescents who also said they felt isolated and felt lonely. So we couldn't identify the reasons why they are lonely, the reasons why they are isolated. Probably it could be due to the containment measures of COVID, and adolescents who say they felt unsafe. Yeah. So, so those were the significant predictors of anxiety. We also looked at the predictors of depression. They were relatively safe. So for the anxiety, we didn't identify any protective factors. But for depression, we found that adolescents who engage with their peers are protected against depression, and that was significant. And those who say they were close with their parents also were protected against depression, and that was significant. So this line here, the dotted line is one. So the ones that are left are protective, the one on the right are the risk factors. We also did some qualitative work, and as I say, the qualitative work was to explore the drivers, what is now causing the burden that we are seeing. And we did some FGD, some focus group discussions, around 20 of them, and then we also did in-depth interviews. So this is an example of an FGD. So we invite the girls or the boys. First of all, they consent, and they also assent, particularly the young ones, those below 18 years.